All right, so today, you and I are going to be medical detectives. We've got two really perplexing puzzles on our hands, and the kidneys, well, they're at the center of it all. So let's crack open that first case file, shall we?
So here's the deal. We've got a confused patient and another with this mysterious rash. Two totally different sets of clues, but it all comes back to the kidneys. Your job? Follow the evidence with me, connect those dots, and see if you can solve these cases. You think you're up for it?
Okay, so our first case, it's about a patient whose entire system is, well, dangerously out of whack. We're calling this one a salty situation, and you'll see why in a second.
So, let's meet our first patient. She's a 69-year-old woman, and she's been getting more and more confused and just sluggish over the last couple of days. And right away, her daughter gives us our first big clue. She's been drinking a ton of water, way more than usual.
Okay, so we pull her file, and a few things jump out immediately. She's got a history of stage 4 chronic kidney disease and a type of heart failure. And when we do a physical exam, yep, our suspicions are confirmed. You can hear crackles in her lungs, her ankles are swollen, she is definitely overloaded with fluid. These are the first breadcrumbs on our trail.
And then the lab results come back. And this, my friends, is where the plot really thickens. Now I know, there are a lot of numbers on this screen. Don't worry about it. A good detective knows you have to ignore the noise and find the real signal. And trust me, there are two numbers here that are basically screaming the answer at us.
Okay, clue number 1. Her sodium, it is dangerously low at 118. The medical term for this is hyponatremia. So what does that even mean? Well, think of it this way. Your brain cells are like little balloons that need a perfectly balanced saltwater environment to work right. When the blood around them gets too watery, water rushes into the cells, making them swell up. And that is what's causing all her confusion. But the big question is, why is her blood so watery in the first place?
And that brings us to clue number 2. And this one's a big one. Her urine osmolality. Now, that's just a fancy way of saying how concentrated her urine is. Think about it. If you chug a bunch of water, what happens? Your pee gets really clear and dilute, right? It's your body getting rid of the extra water. But look at hers. It's concentrated. That makes no sense. And that, right there, is our smoking gun. It tells us her body, because of her kidney and heart problems, has lost the ability to get rid of all that extra water she's been drinking. It's just trapping it inside.
So, putting it all together, what do we have? The diagnosis is hypervolemic hyponatremia. Let's break that down. Hypervolemic means too much fluid volume, and hyponatremia means low sodium. Simple, right? She drank way too much water, and her body just couldn't pee it out. So, case closed, right? Well, not quite. Now comes the really important part. What do we do about it?
So, we figured out what's wrong. Now, how do we fix it? What's the first thing you would do to help her get better safely? This is one of those moments when the next move is absolutely critical.
Okay, so here's the absolute key. The problem isn't that she's missing salt, the problem is that she has way too much water. So the correct move, the only right move, is to restrict her fluids. We limit how much she drinks, and that gives her body a chance to slowly rebalance itself. Now you might think, low salt? Let's give her salt water, give her a saline IV. But that would be a huge mistake. You'd just be pouring more fluid into a body that's already drowning in it. It's a classic trap, and we just avoided it.
All right, one case down, one to go. And this next one is a whole different beast. This time, a patient comes in with a sudden, full-body crisis. We're calling this one a dangerous reaction.
So our second patient is a 55-year-old woman. And honestly, the timeline here pretty much tells the whole story. Let's walk through it. 6 weeks ago, she starts a new medication for her blood pressure. Then, just 5 days ago, bam, fever, a rash everywhere, achy joints. And now today, she's in the hospital and her kidneys are failing. That timing, that's clue number 1, and it's a big one. And just like before, the blood work gives us the clincher. Take a look at her eosinophil count. It's more than double what it should be. So what are eosinophils? They're a type of white blood cell, kind of like your immune system's special forces. They usually pop up to fight parasites, but they also go haywire during a big allergic reaction. This high number is a giant flashing sign that says, this isn't an infection, this is an overreaction.
So let's put it together. We have a timeline that points right back to that new medication, and we have blood work that's basically screaming allergic reaction. Suddenly, it all clicks into place. The culprit? It's the new blood pressure pill. It's caused a massive, body-wide hypersensitivity reaction, and her kidneys are caught right in the crossfire.
The official name for this is acute interstitial nephritis, or AIN for short. And what that means is a really severe allergic inflammation happening inside the kidney tissue. And get this, the textbook classic symptoms for AIN are fever, rash, and high eosinophils. Our patient, she had every single one. It's a textbook case of a really serious problem.
So there you have it. Two completely different puzzles, both solved. But what's the takeaway here? What did we actually learn from our detective work? What were the fundamental rules that helped us get to the right answer in both situations?
Well, it really boils down to 3 simple rules for being a good diagnostic detective. Number 1, listen to the story. In our first case, it was the water drinking. In the second, it was the new pill. The history is everything. Number 2, question everything, especially anything that's changed recently. And number 3, trust the clues. Don't get bogged down by all the data. Find those 1 or 2 key lab values, the low sodium, the high eosinophils, that tell you what's really going on. And you know, that really leaves us with one final thought. If you take this exact same approach, listening to the story, questioning the details, and trusting the key clues, just think about it. What other big, complicated mysteries, whether it's in medicine or just life in general, are hiding right there in plain sight, just waiting to be solved? Something to chew on. Thanks for putting on your detective hat with me today.